relate to us. What was it like, being denied so many times that you're not a candidate, you're not a candidate, and what was it like to have the vision with such a high astigmatism? Astigmatism meaning your cornea shaped like American football rather than basketball. So she had this distortion due to a high astigmatism all this time. And her astigmatism, let me give you a sense, was so high, I probably have to go through 50 years, you got the number there. Yeah,
number.
Yes, and it had to be probably 50 to 100,000 people to get one like her.
Wow.
So 100,000 people.
He tells me I'm one in a million, though.
Yes, yeah, that's right, very rare. So maybe relate to us, what's it like to be rejected for all these years by different doctors, and what your vision problem was like, and how do you feel like finally you were able to get help, and what you are doing now?
Yeah, when I was 6 years old, I noticed my eyes not doing as well, so my parents took me to the eye doctor, and I got glasses, which is what every 6-year-old wants to do in the first grade. So I had glasses until I was 12 years old. My parents told me at that time I could get contacts. So I was so excited. I was about to turn 13 and I could get contacts for the first time. My eye doctor I went to told me that, well, he didn't tell me, he told my parents, she will never be able to wear contacts. Her eyes are too bad, they're too messed up, contacts will never work. Luckily, he didn't tell me that. He didn't understand the determination of a 13-year-old girl that was fixing to be in the 8th grade that she couldn't wear contacts. So I had special hard lenses, which are little bitty tiny contacts, if any of you've ever worn them. They're hard, they're like glass, they're not like the little flexible things you see. And they don't move in your eye really well. If you wear them for too long, you can't see the next day. You have to stay in a dark room, and unfortunately I've done that a few times. But anyway, so I wore those, and I wore those for years and years, and I won't say how many years. But up about 4 years ago, I started having problems with those contacts. I couldn't wear them anymore for over 3 or 4 hours at a time. My eyes would itch, and I would have so much pain. So I went back to my glasses, and which didn't bother me. I mean, I don't care to wear glasses now that I'm a mature person. I don't care to wear glasses, but I noticed my vision was getting worse with my glasses, where it was kind of maintaining it when I had my contacts. And so I tried a few times. The eye doctor I went to for years and years told me, and I'm quoting this, Vanessa, there will never be a procedure in your lifetime that will fix your eyes. Technology is just not going to evolve that much in your lifetime. So that was back in probably my 20s. Then in my 30s, I went again. And went to a different doctor. And asked the same thing. No, can't do it. Can't do it. There's nobody, there's nothing that can be done. You're always going to be wearing glasses. That's just what you're going to do. And when I studied and I decided, I've got to do something. So I came here, I called and I came here, and I'll tell you, and I'm sorry, I'm going to get emotional, but the most devastating part of sitting in the room is when you're looking at the letters on the screen and you can't tell the big E is an E. Okay? You can't tell that. And I couldn't read the big E. And that was heartbreaking to me. So I told them what I was here for. I said, I know it probably can't be done. I told Dr. Wang, I said, I'm probably going to be had the least expectation of any patient you will ever see. I don't expect you to be able to do anything. I don't expect anything you do to be able to work. I'm just being honest, completely honest. He said, well, let's just see. So he told me that he couldn't eliminate it, that he could reduce it. We could do a reduction, about 80%. I would probably always wear glasses. I would always need readers, but I may be able to go without glasses, but I would always need readers. And I said, you know what? That's fine. I just want to get back to where I could wear contacts again. I don't want to see my vision deteriorate anymore. So we went ahead and scheduled it, and I came in here. I was the same way. They had to give me a Valium because I was a little bit anxious that day. But the next day I came in for my follow-up, and I looked, and not only could I read the big E, but I could read the 20/20 line with nothing on my eyes. I just had naked eyes, and I was reading 20/20. So I went from having this restriction of 01 on my driver's license, which, by the way, if it had not been for the Tennessee State lady who worked there helping me, I still wouldn't have this license, because she said, "Don't you think that looks like the letter G?" Yes, ma'am, I do. I think that looks just like the letter G. If she hadn't helped me, I still wouldn't have a license today. But when I walked out of here almost a month ago, I have this card now that says she doesn't have to have anything to drive. She doesn't have to have anything to read. I can read. I work on a computer all day long. I made notes in little bitty writing, so I wouldn't forget to tell you anything with no glasses. I don't have to have readers, so I have to say, Dr. Wang, sorry, you were wrong. But you know, I'm not to that age yet. Give me a few years. But I walked out of here a different person. Not that I was vain and that I wanted to not wear glasses because I thought it would hurt my appearance or anything. I wanted to do it for being able to see again, which I've never been able to see 20/20, even with glasses or contacts. It's always been 20/25 or 20/30. But I walked out of here after surgery with 20/20. Now, granted, I'm going to have setbacks, because as bad as my eyes were, he's told me that, you know, you're probably going to have a touch-up. And I understand that. I completely understand that. But I'm okay with that, because if it gets no better than it is today, then I'm okay. And I'm going to be okay. And when I have to get readers, I'll be okay with that too. But it's been a big improvement, and the big E is no longer my enemy. It is my friend. And the 20/20 line is where I'm reading now. Thank you.
Thank you.